Hi, I'm Nicole Rena, and I'm bringing you a video case study from New Jersey. I am outside today because it's 70 plus degrees in New Jersey, and quite frankly, it's the only quiet place in the house. So the case study that I'm presenting to you is a 19-year-old female annual physical exam for our clinical residency and practice management. So the patient's name we'll say is Jay Smith. She is 19 years old. She reports that she is here for her annual checkup. So we have the nationality and the race, of course, and date of birth. So the HPI, history of present illness. She is a 19-year-old obese female, BMI of 37.8, which presents for an annual exam. Patient reports 10 plus pound weight gain in the last 8 months, decreased energy, and increased insomnia and anxiety. Reports seeing a therapist when she was 16 years old related to depression, anxiety, and was last seen her therapist at age 16. BP was slightly elevated today. We have the right and the left blood pressure. Her heart rate was regular rate and rhythm. She does have a family history of hypertension, hypercholesteremia, depression, and anxiety. As far as past medical history, she has a history of depression and anxiety, again diagnosed around age 15. No past medical procedures or hospitalizations. Medications include a multivitamin, oral contraceptive, loestrin FE, Zyrtec for her seasonal allergies. Allergies or intolerances, she has no known drug allergies, food allergies, or intolerances, but does report seasonal allergies in the spring and the fall. As far as family history and social history, last menstrual period was 10/24. She is regular on the oral contraceptive, and then there's also fine details regarding her menses and her age of menarche. Family history: her mother is 60 years old, alive and well, with a history of hypertension, hypercholesteremia, depression and anxiety, diabetes, obesity. Father is 62 years old, alive and well, and she has a sister, two sisters, and a brother, and they are all alive and well. Denies family history of cancer, diabetes for the siblings, maternal and paternal grandparents. There's no history of chronic diseases, and they are both alive. With this case, it's important that we know, and with most cases, that they deny family and personal history of suicide or suicide attempts, especially with her history of depression and anxiety. Social history. We like to take a very in-depth social history. In fact, the practice that I'm working at allows an hour for physicals and also an hour for meet and greets before a physical to do all this and get through all this to know about the patient, which is really nice, and I don't know a lot of practices that are able to do that. So as far as social history, she is sexually active with one male partner for 3 years, no previous sexual histories, and denies any problems. No tobacco use or present or past, no alcohol, no drug use, marital history. She is single, and occupation, works in a daycare part-time, and is an undergraduate student at night and day full-time also. Social history and immunizations. She does report poor diet, tends to not eat all day, and then around 4 p.m. is extremely hungry and feels she overeats. She also reports that she works till late or is doing class till late or studying late, so she sometimes eats dinner after 10 p.m. She reports drinking water, orange juice or apple juice, diet soda, coffee, Monster energy drink, and Gatorade, so there is a lot of empty calories and sugar there. She reports walking about once a week around her block, about half of a mile. Caffeine. She reports 2 cups of coffee in the AM, 1 in the PM, and at least 1 Monster energy drink daily. And we know if we say at least, it's usually 2 or more, right? When some of our patients say at least. Sleep and stress. No recent illnesses, exposures, or travel out of New Jersey. No history of COVID-19 exposure or sickness. Patient reports maintaining social distancing, wearing a mask when out in public, washing hands, and she sleeps 6 to 8 hours a night. She wakes feeling rested on most days, does not feel daytime drowsiness, and denies snoring. So that's important regarding sleep apnea, especially with the obesity. Highest level of education, high school and full-time college student. Safety, reports several close friends, feels safe at home and in current relationships, report use of seatbelt, bike helmets, and ski helmets. This is important, especially with a teenager, new driving, and at least that she has several close friends, and of course that she feels safe at home. These are questions that you want to ask every patient to make sure that they feel safe at home and in their environment, because it could be the only time somebody actually asks them and they get a chance to actually report something like that. Immunizations, as you can see, she's had her Tdap for meningitis, she's had 2 doses of the HPV vaccine, and she got her influenza administered today. Review of systems. Each patient in this practice does do a review of systems sheet and then a fall assessment sheet. And also, as a new patient, they do an extensive medical social history sheet. We kind of use that as a worksheet as we go through with the patients, which is very helpful. So this is her review of systems. Significant for reports 10-pound weight gain in the last 8 months, did have a physical a year ago. Everything else is okay. She has no chest pain, no palpitations, no dysuria, no dysphagia, no female complaints, no stiffness, no joint swelling, decreased range of motion. And then neurologically, she denies seizures, and she also denies a history of concussion, which are important to note in the teenage population, especially teenagers that play sports, because there's been significant increases in the amount of head concussions and long-term effects from that. Review of symptoms and objective continued, and then we go into the physical exam here. She denies anxiety, depression, and mood changes, but she does end suicidal and homicidal thoughts, but she does, as you'll see later in the case study, we do a questionnaire, and it does come back as high for possible depression or anxiety. So physical exam, there was not really much to comment on. Everything looked pretty good. Abdomen was soft, regular heart rate and rhythm, no murmurs, no gallops. Extremities well perfused, neurologically appropriate, conversational, happy to converse with me, interactive. And then here for psychiatric, denies suicidal and homicidal thoughts. She does state that she's been feeling tired, drained, low energy, and worried that her history of depression, anxiety is flaring up with current state of world, election, COVID-19, and feels unable to keep up with her job, school, etc. She states she has insomnia at times and feels like she needs coffee and caffeine to get through the day. So these are opportunities that, by talking to your patient, we discovered that they could use some counseling and some encouragement in this area. And we're only going to know this by doing a really good review of systems and history and physical with our patients. The patient health questionnaire. This is what we, at the practice, they do this on every patient that's coming in, or any patient that's following up for psychiatric medications. The patient health questionnaire. I also included some information and facts about depression, which of course you can read through that, and I can submit sources and this PowerPoint to anyone who wants to look at it. The patient scored a 12 out of 27. And usually a score above 10 indicates a probable or possible depressive disorder. This is the longer questionnaire, besides the patient health questionnaire 2, where there's only 2 questions that you ask the patients. So this gives a little bit more information. It's easier to follow them with. And then I think it's important that they're using this screening because according to UpToDate, depression is the most common psychiatric disorder in the general population, and the most common mental health condition patients are seeing in primary care. And a lot of patients are not apt to discuss this with their patient, with their provider, unless they're asked and approached on it. Assessment and diagnosis. So with her differential diagnoses, we're ruling out hypertension because her blood pressure was a little elevated and she does have the family history of hypertension. We are ruling out anemia, hypothyroidism, chronic fatigue syndrome, not symptom, syndrome. So for the assessment and diagnosis, differential diagnoses, we would want to rule out hypertension, anemia, hypothyroidism, chronic fatigue syndrome, and final diagnosis for this patient was adult physical with abnormal findings, obesity, increased body mass index, encounter for screening for depression, personal history of mental health and behavioral disorders, family history of elevated cholesterol, family history of and personal history of depression and anxiety. Plan, we did a CBC with differential, a CMP, a hemoglobin A1C with their family history of diabetes, a TSH, fasting lipids, a vitamin D, and vitamin B12. We're going to continue on present medications in our plan, multivitamin, the Loestrin, and the Zyrtec. And then we also advised it's starting a vitamin B100 complex to help with the symptoms of depression and anxiety and to help with metabolism. At this time, in this case, the patient refuses antidepressant or anti-anxiety medication. She says that she doesn't really want to go back on those. She did have success with 1 or 2 of them, so we discussed that we will further monitor her symptoms. We will try some lifestyle choices and follow up in a week or 2 and see where her symptoms are. We also think that this patient could benefit from seeing her previous psychotherapist and reestablishing care, a nutrition consult to discuss the diet and high BMI, education and follow-up, monitor blood pressure every morning till follow-up and bring the log, discussed increasing H2O, decreasing sugar, caffeine, diet soda, and monster beverages. Nutrition counseling, we discussed eating breakfast, the most important meal of the day, increasing fluids, decreasing late night eating, increasing fresh fruits, fiber, lean meats, proteins, decreasing fatty, fried, fast foods, high processed, high sugar content, also decreasing with the blood pressure, sodium intake. Especially, we discussed the processed and the prepackaged foods and reading sodium labels and nutritional information. Then we also discussed some recommendations regarding moderate exercise and strength training, discussed teen driver safety and uses of the seatbelt, discussed oral contraceptive use and how important it is and how it can interact with other medications. We also discussed safe sexual practices and the use of condoms. Maintaining good sleep hygiene, and the patient does live with her parents, has good social support and extended family in the area. Then we also discussed following up with any new or worsening symptoms, increased pain, and we will have our nurse follow up in 2 days regarding depression and anxiety to see how the patient's doing. The patient was applicable with this plan. There were some changes that she's willing to discuss and make, and we'll just consider she can send messages through us in this practice through the patient portal that we can check in, or she can call, and then we'll have our nurse follow up with her. And then these are my references. So thank you for joining me and listening to my case study. I welcome any suggestions, improvements, or things that I can add to the case study. And I thank you all for watching. Good luck with yours.